Hey, welcome back. I'm Lina, and if you are serious about living longer, feeling stronger, and staying sharp well into your 60s, 70s, and beyond, this video might be the most important one you watch all year. Here's what I want you to do right now. Pause, go to your kitchen cabinet or your little weekly pill organizer, and just take a quick mental note of what's in there. Because today we are talking about 9 medications, some prescribed, some sitting right on the pharmacy shelf that could be quietly working against your longevity goals. Not because anyone made a mistake, not because your doctor isn't great, but because nobody ever had the time to sit you down and walk you through what these things do to an aging heart over months and years. And that changes today. I'm a health educator, and the one thing I have learned from studying longevity research obsessively is this. The biggest threats to a long, vibrant life are often hiding in plain sight. So let's shine a light on them. Before we go further, if you are new here, hit subscribe. I put out videos every week on exactly this kind of practical, science-backed longevity information. Now let's get into it. Okay, here's the key insight you need to carry through this entire video. Every single one of these 9 medications does its damage by pulling on one or more of 4 levers in your body. Lever 1, blood pressure. Lever 2, clotting. Lever 3, vessel tone, how relaxed and open your arteries stay. Lever 4, heart rhythm. When you understand those 4 levers, none of this is scary or mysterious. You become someone who understands their own body. That's the longevity mindset. Ready? Let's go. Number 1 is something in almost every home in America. Advil, Aleve, Motrin. The everyday anti-inflammatories we grab for a sore knee or an aching back. Here's what makes them a longevity concern. They tell your kidneys to hold on to salt and water, which drives blood pressure up. And they shift your body's clotting chemistry, making your blood stickier. Higher pressure and stickier blood from a pill you bought without a prescription. Back in 2015, the FDA actually strengthened the warning label on every one of these because the heart risk can appear in the first weeks of regular use. The people who get caught are the ones taking these daily for arthritis while also fighting high blood pressure and never connecting the two. The move? For everyday aches, ask your doctor about acetaminophen or a topical anti-inflammatory gel you rub directly on the joint. Barely enters the bloodstream. And if you do need an NSAID, use the lowest dose for the shortest stretch. And tell your doctor if you're taking one regularly. That one conversation changes everything. Number 2 hides in the cold and allergy aisle. Oral decongestants. The Sudafed-style pills and anything with a D at the end of the name, like Claritin D or Mucinex D. They clear your stuffy nose by tightening blood vessels in your sinuses. The problem? They cannot tell your sinuses apart from the rest of you. They tighten blood vessels everywhere. Blood pressure spikes, heart rate climbs, your heart is suddenly pushing against narrowed pipes, and you're thinking it was just a cold pill. The great news is the swap here is so easy. Saline nasal spray. An over-the-counter steroid nasal spray like Flonase. Neither one touches your blood pressure. If you have any heart history or elevated blood pressure, the oral decongestant is the one product on that cold aisle shelf to leave alone. Number 3 is the short steroid dose pack, Prednisone, that doctors hand out for arthritis flares, asthma, skin conditions, and more. And listen, sometimes you genuinely need it. Steroids work. But they pull on 3 of our 4 levers at once. They cause fluid retention, blood pressure up. They raise LDL, the harmful cholesterol that builds plaque in arteries. And they nudge your blood toward clotting. A large 2017 study found that even short courses were linked to a jump in heart attacks and clots in the weeks right after. The danger is the person who's doing a dose pack every few months for a recurring problem, with nobody ever adding up what that looks like over a full year. Ask your doctor, is there a non-steroid option? If steroids are necessary, keep the course as short as possible. Have your blood pressure and blood sugar checked while you're on it. And here is a non-negotiable. Never stop a steroid suddenly on your own. After more than a few days, your body slows its own production. You taper off slowly with your doctor's guidance. Always. Number 4 is hormone therapy. Estrogen for women managing menopause symptoms, and testosterone, which is being prescribed more and more freely for men chasing energy and vitality. Hormones change your blood chemistry. They make platelets, the tiny cells that form clots, stickier and quicker to activate. A clot that forms where it shouldn't is exactly what causes most heart attacks and strokes. This doesn't mean hormone therapy is off the table. For many people, it's genuinely the right call. What it means is that the dose, the delivery form, and the duration all need a real conversation. For estrogen in particular, the patch or gel that absorbs through the skin carries less clot risk than the pill form because it bypasses the first pass through the liver. Make sure your personal history and family history are part of that discussion. Real quick, if this is the kind of information you wish someone had handed you years ago, 2 things. Hit that like button. It tells YouTube this is worth sharing, and it helps me reach more people like you. And drop a comment below. Tell me your age and how many of these 9 you're currently taking. I read every single one, and that feedback genuinely shapes what I cover next. Okay, we're halfway through. The next 5 are the ones most people have never thought about. Number 5 surprises almost everyone, and it's the one I find most fascinating from a longevity standpoint. The thyroid pill. Levothyroxine. Millions of people take one tiny tablet every single morning, and the medication itself is not the villain. The dose is. Your thyroid controls the speed of your whole body, including your heart. Most people were put on a dose years ago, and it was never revisited. But as you age, your body often needs less. So the dose that was perfect at 52 might be running you too fast at 68. Research from the famous Framingham Heart Study found that when thyroid levels run even slightly too high, the risk of atrial fibrillation, a fast, chaotic heart rhythm that's one of the leading causes of stroke, roughly triples. The fix is one of the easiest on this entire list. Ask your doctor for a simple TSH blood test. Ask one clear question. Is my dose still right for my age? A small adjustment could protect your heart for the next decade. Number 6 is what I call the forever pill problem. Proton pump inhibitors, the purple pills, omeprazole, esomeprazole, brands like Prilosec and Nexium. You can buy these right off the shelf. They're excellent at shutting off stomach acid. The long-term catch is that they appear to reduce your body's supply of nitric oxide, the natural chemical your blood vessels use to stay relaxed and open. Less nitric oxide means stiffer, tighter arteries. A 2015 analysis of hundreds of thousands of patient records found that long-term users had a higher rate of heart attacks. They can also interfere with a common blood thinner that some heart patients depend on. These became forever pills because people started them for a few weeks of heartburn and are still on them a decade later. No review, no end date. If you need one for a diagnosed condition, keep taking it. Your doctor knows your situation. But if you drifted onto one for everyday heartburn, ask about stepping down. Smaller evening meals. Not lying flat right after eating. Sometimes that's enough. Number 7 is one most people have never heard of, but the warning attached to it is about as serious as medicine gets. JAK inhibitors are newer drugs for autoimmune diseases, rheumatoid arthritis, certain bowel diseases, severe eczema. The names end in tinib. A large clinical trial published in 2022 found higher rates of heart attack, stroke, and blood clots with one of these drugs, especially in people over 50 who already had any heart risk factor. The FDA responded with its strongest possible label warning. If you have a serious autoimmune condition, these drugs can genuinely transform your quality of life. This is not about fear. It's about having a direct conversation with your specialist every year. How does my personal heart risk weigh against the benefit? And is there an older, gentler option that controls my disease just as well? Number 8 is the one that concerns me most when it comes to how broadly it gets used. Atypical antipsychotics, quetiapine, risperidone, brand names like Seroquel, these have real, legitimate uses, but they are prescribed far too often to older adults simply for sleep or to manage agitation in dementia patients. They hit two levers hard. They drive weight gain and raise blood sugar, which ages your arteries faster. And they can alter the heart's electrical timing in ways that set up dangerous rhythms. The FDA carries a boxed warning that in older adults with dementia, these drugs are associated with a higher risk of stroke and death. If you or someone you love is taking one primarily for sleep or to ease agitation, that's the prescription to question. Ask the doctor, is this truly necessary? Can the dose come down? What non-medication options exist? And, like the steroid, this one tapers slowly, never stopped suddenly. Number 9 is the long-term prescription painkiller, oxycodone, hydrocodone, tramadol, often given for chronic back, joint, or nerve pain. Most people think of these as a breathing and dependency risk, and they are. But there's a heart story too. Opioids dull the part of your nervous system that steadies your heart rate and breathing overnight. That's hardest on an aging heart. A 2016 analysis in JAMA found that long-acting opioids were linked to a higher rate of cardiac death compared to other pain treatments. The goal isn't to suffer, it's to find the lowest effective dose and to actively explore what else might work. Physical therapy, nerve-targeting medications, targeted injections. These aren't consolation prizes. For many people, they work better with far less risk. And just like the steroids and the sleep medications, taper with your doctor, never on your own. Let me tell you about someone I'll call Margaret. 66 years old, sharp as a tack, doing everything right. Daily walks, blood pressure medication on schedule. But her pressure sat stubbornly in the 150s, and she started noticing her heart would occasionally race in a way that unsettled her. When she finally sat down and laid out everything she was taking, prescription and over-the-counter, the picture got clear fast. Daily ibuprofen for her hips, a heartburn pill she'd been on for 8 years, a decongestant she reached for most mornings, and a thyroid dose that hadn't been checked since her mid-50s. 4 ordinary things. 3 bought without a prescription, all 4 pulling on her heart at once. She didn't need a new medication, she needed 3 of her old ones reconsidered. Her thyroid was adjusted. She swapped the daily ibuprofen for a topical gel and acetaminophen. She replaced the oral decongestant with a saline spray. A few months later, her pressure was in the low 130s. Her heart rhythm was steady. She told me she felt like herself for the first time in years. Same person, same house. A few smart, informed conversations with her doctor. That is what longevity actually looks like in practice. Here is your action plan, starting tonight. Step 1. Go to that cabinet or that pill organizer and write down everything, prescription and over-the-counter. The ones you bought yourself count just as much. Step 2. Check it against these 9. The everyday painkillers, the decongestants, the steroids, the hormones, the thyroid pill, the heartburn pills, the autoimmune drugs, the sleep medications, the opioids. Step 3. Pick your number one question. If it's the thyroid pill, ask for a TSH recheck. If it's the daily anti-inflammatory, ask about a safer pain option. If it's the heartburn pill, ask whether it's time to step down. Step 4. Bring the actual bottles to your next appointment. Put them on the desk. That single act does more for your longevity than most supplements combined. One firm line before you go. Do not stop any of these on your own. Several of them, the steroids, opioids, and sleep medications, are genuinely dangerous to quit suddenly. And if you ever experience chest pressure, pain spreading into your arm or jaw, sudden weakness on one side, facial drooping, or trouble speaking, that is not a medication question. Call emergency services immediately. That's an emergency in progress. These changes are for the long game, and you are in this for the long game. Now, we spent this entire video on pills, but here's something I want you to know. Some of the everyday supplements people take specifically to feel healthier can actually thin or thicken the blood and collide with these exact medications. I made a dedicated video on the combinations you should never mix. It's on your screen right now. I'll see you over there. Keep going. You've got this.